My name is Jade McKnight. I am a part-time MPH student. I've been working at Penn Memory Center as a component of my master's fieldwork. I've been working here since about January. My responsibilities include outreach to research participants. I've been working on a couple of different projects. Dance for Health, I've been participating in a lot of health fairs, and I recently gave a talk at the Southwest Senior Center on Alzheimer's disease and involving the older African American members of the Senior Center in research. So, Dance for Health is a program that was started by Dr. Terry Littman in the nursing school. She initially started the program to engage younger kids in dance and also teaching them about nutrition. So when Penn Memory Center got involved, we were recruiting older adults for the Dance for Health program. We did cognitive testing before and after. It was a 14-week program, so university students got involved over the course of the semester. My specific role was to act as a liaison between the Penn Memory Center recruited participants and the Penn Memory Center. I would attend the Dance for Health classes, which met every Thursday. It was about a 90-minute course. There was food afterward. It was a really great time for Penn Memory Center folks to, again, meet others in the community who wanted to dance, learn easy to difficult line dancing, and also to just learn about nutrition and just grow their social network. A lot of our participants are older, not working, so when we promoted the Dance for Health program, we really wanted to market that you would meet lots of older adults who found similar interests to you. A lot of the participants already liked to dance, but because they were retired or lived further out of the city, they wouldn't have opportunities to engage with other adults who like similar activities. So every Thursday, it was a great time for them to come in, say, oh, hey, how was your week? I saw you on Thursday. Oh, did your doctor's appointment go well? Great, let's get to dancing. It was really fun for everybody to just, brighten up your otherwise boring week. Each Thursday, I would go to the program after work or after class. I would sit down, make sure that all of our participants that we've recruited got in okay, that they weren't having any particular difficulties. I would chat with them briefly before the dances started and during the breaks, asking them if there was anything that they'd like to see improved, or if they noticed that they were feeling a different way about the dance courses or the dance lessons in general. I got to develop a really great relationship with some of the participants, and it was really, really nice to be able to grow with them as they would get better at the dances. Some started off with little to no dance experience, but others were better at it, so it was nice to be able to see them improve their dance skills, but also to just have a good time on Thursdays. I presented the results that we got from Dance for Health. We did cognitive testing before the program started, and we did the same testing after the program started to evaluate the effect that dance had on memory. After that, I presented to the Healthy Brain Research Network, and even though our sample size was kind of small, we did come up with some really meaningful data, which allowed us to present a pilot program at Ralston House for a similar Dance for Health program during the day. I really learned a lot from this program, mainly that dance does affect one's cognitive health. It affects your outlook on life. It affects your happiness, your stress levels, and that was really evident in our research. Part of my role as the fieldwork intern with Penn Memory Center was to engage in outreach within the community. And as a master's in public health student, that's something that they really, really drill in on, community-based participatory research. I participated in a lot of health fairs within the community of West Philadelphia specifically, and I ultimately culminated in a brief talk about Alzheimer's disease and research at the Southwest Senior Center. At the Southwest Senior Center, I spoke to them about Alzheimer's disease and dementia, the differences between the two. I also spoke to them about engaging in research, specifically promoting our brain health research registry. I told them that a lot of times engaging in research is the only way that we can really understand how a particular disease affects a community. So because the members of the community center were mostly African American, it was an ideal location to promote participation in research among older African Americans. African Americans are affected by Alzheimer's disease twice as much as our white counterparts. So, knowing that, I wanted to specifically recruit the individuals at the senior center who may want to be engaged in research but not really understand where or how, or how easy it is to get involved. When I first engaged in the Master's in Public Health program, I kept hearing the term community-based participatory research, and it just seemed like a bunch of mumbo jumbo until I really engaged in participating in research and recruiting the community members for research. Penn Memory Center does a great job of making sure that the community in which they work is engaged in research, is commenting on what happens, and that everyone is aware of what is going on in terms of Alzheimer's disease specifically and the initiatives that we're promoting within the community. I really enjoyed being able to get on the ground and talk to people who are interested and people who may not be interested but want to learn more about it. As a public health professional, I feel like it's very important that when you're promoting and disseminating research in the community, you need to be a part of that community. So the fact that I live in Philadelphia, I work in Philadelphia, and I attend school in Philadelphia, it's really important to me that I engage Philadelphians in the work and research that I'm doing. So working with Penn Memory Center has really been able to allow me to get into the community and share the work that I've done and share the things that I've learned with people who may not have had the opportunity to learn such things. Specifically, learning about the benefits that research has on Alzheimer's disease and dementia.